Assalamualaikum warahmatullahi wabarakatuh, and a very good day. First of all, I would like to express my gratitude to Professor Zahara for inviting me from NATMA. And this is the first time we try to conduct this session, not really online, but by the way of recording my teaching, I guess. Not really teaching, my sharing session through video, so that it can be enjoyed by all of the students from HUKM related to these courses. With the ambit and within the frameworks of the clinical dietitians, as well as the topics that were given to me, food relief and disaster, as well as global outreach, I would like to focus on a few things. First, all the details handout has been given to Professor Zahara so that it can be circulated earlier to all the students that involved with this session. And I would like to spend around 20 to 30 minutes sharing this video so that we can appreciate more in terms of how disaster in Malaysia is managed, as well as how we are incorporating the elements of clinical dietitians as well as NGO approach according to clusters. Alright, first set is about NATMA and the management of disaster in Malaysia. NATMA is actually the government agencies entrusted by the government. We are national disaster management agencies, the focal point for all disaster related matters. The details of disaster related matters you can refer to National Security Directive Council number 20, or in Malay we call it MKN20. You can find there the definition of disaster, the structures and mechanism of disaster, who call the shot and who makes the decisions based on tiers and phase of disaster. As we all know, Malaysia has two types of government, the federal government and the state government. At the state government, we have district level. Rarely it happens, the disaster happens all at once, and covering the whole Malaysian. Normally it will happen for natural disaster especially. It will happen at the district level of one or two kampungs, and then escalated to district level, and then escalated to state level, and so on and so forth. At the district level, we have the district officers who is in command for all matters related to disaster management at the district level. He calls the shot, he calls all the agencies under the district levels so that he can know the capacities, capabilities, and strengths of personnel related to disaster, so that he can make planning, he can deploy sufficient staffing, as well as identify infrastructures such as temporary shelter and the command center, as well as financing mode to those who are being affected. So remember this, at district level, those who make the shot is actually district officers. Then when more than 3 to 4 districts being facing with the national disasters challenge, it will be escalated to the state level. At the state level, the state secretary will have the mandate and will chair and will conduct all matters relating to disaster that cover his states and all the affected districts. District officers still exist because they have to implement whatever measures that need to assist those who are in need, and then he will ask for additional assistance from the state secretary or at the state level. At this stage, although you cannot see directly the federal government intervention, indirectly we have Angkatan Pertahanan Awam Malaysia as the secretariat for the disaster at the district and at the state level. So this is the federal agencies who are in charge solely as a secretariat, who will advising the district officers as well as the state government all matters related to disaster. We also have what we call Wang Ehsan, some sort of financial assistance to those families who were affected by the disaster. It's about 500 ringgit. And then if more than 2 states, like in flood 2014, tsunami 2004, faced with these calamities, then the federal government will intervene directly. So we have to respect the layers, because we only the federal can only supplement the action taken by the district and state level before we can jump and lead the disaster operation. That's number one. Understand this mechanism and this structure first. And then now, who's the players involved in the disaster management at the districts, states and the federal level? It all outlined by the National Directive Council number 20, HUKM20. We have, we call it as the working groups based, that is supposed to prepare all the information related to the capacities. Like in the current turmoil, we can see, although it is disaster led by NADMA, the lead agency is Ministry of Health. Directors General of Health Department, DG Hisham, is actually the one who spearhead this COVID-19 disasters. And this disaster is now escalated into security issues because it's prolonged, affected many people, and people become unrest. So it trigger also the National Directive Council number 21. Okay, so TS, district, state, federal. The secretariat is APM, and at the federal level we have NADMA as the secretariat. It is chaired by the Prime Minister or any minister appointed by the Prime Minister itself. Before this, we have our Deputy Prime Minister appointed by the PM to spearhead and becoming the chair of the national, the Disaster Management Council at the national level. At the state level, we have State Secretary and then district officers. I think we have some clear understanding on the structure of mechanism in dealing with the disaster, especially through the frameworks of government agencies. There are no one government agencies can proclaim that they are the sole agencies, one-stop center that deal with all matters related to disaster, because every government agencies have their own strengths, have their own specialties and capacities related to handling disaster. Now, I would like to give some explanation related to food relief and perhaps some dietetical nutrition information. I try to give a normal disaster scenario, the flood incident. When the flood happened, normally during monsoonal season, October until December or the next coming years. So the cyclical of monsoonal season is not only started, the disaster is anticipated to start in October onwards. However, the job or the operation related to it already start early. The district officers, the state government will have at least 2 meetings of the district management and state management level coordinating the disaster efforts as early as January itself, whereby they are compiling all the infrastructures and assets required to handle the upcoming disaster, as well as having some post-mortem with the previous monsoonal season challenge. And they already identify temporary shelter for those who are infected. In this temporary shelter is taken care of by the welfare department. All the victims who are supposed to go to any temporary shelters have been taken care of, especially they have their meals provided, they have their camp, toto, pillows, and all basic necessities will be provided at the temporary shelter. That's number one. Number two, in terms of these diet nutrition values or dietitian nutrition values, we are complying with the World Health Organization, whereby we have the United Nations guidelines in terms of providing humanitarian assistance. Let's say what is the minimum carbohydrate requirement for per pax per shelter, what is the minimum requirement of water, the standard hygiene and sanitation. All of this having that I share already in the handout and template is complied by our welfare department. Of course, the scenario abroad is much different from us, whereby let's say refugee camp, they are catering refugees and setting up camp whereby they have to start from zero, the area, the distance of water resources, the electrical powers and whatnot. But here in Malaysia, especially related to flood, they have their temporary shelter. Normally schools and public infrastructures being used as our temporary shelter. There you have the complete water resources, they have these electricities and sufficient room to cater for gender, family issues and whatnot. Of course there are challenges, but then again we have proper establishment to taking care of our people during this flood disaster. Now the current incident is COVID-19. Even when the government make a decision that we have to quarantine all those returning Malaysians abroad, we are not sending them to a downgraded places. We send them to our public institutions as well as hotel. That is how much the government is taking care of their people. And I involved directly as the commander for rescue mission to bring back our Malaysian in Italy from 26 March until 25th to 26 March, and then I have to be quarantined in Akademi Kepimpinan Pengajian Tinggi Sepang for about 14 days. You can see how inter-agencies are coordinating and sharing their expertise in just one mission. The Ministry of Foreign Affairs, through their embassies in Rome, has to compile the data how many Malaysians want to go back during this period. And then the government of Italy requesting assistance from the government of Malaysia to also bring back the stranded Italian in Malaysia using our AirAsia flight. Then we have to coordinate with the Ministry of Health in terms of our protections, equipment, mask, PPE and whatnot, and how to ensure the flow by ensuring the medical record of the Italian who are also in the flight from Malaysia to Rome. How we have to separate them to make sure that there are no exposures and contamination, possible exposure and contamination by them, and to protect our staff who are also in the flight. We are 27 crew members mission, and then we went to Rome, FCO. Then we are taking back 81 Malaysian from Italy. So we have Ministry of Foreign Affairs, Ministry of Health, Welfare Department, the Fire Department, the APM, Police, NATMA, Asia Crew, Malaysia Airport Holding Berhad Crew. So at least 8 to 10 agencies are dealing with these matters. So inside the aeroplane, we have to ensure that sufficient meal. So we keep on thinking how to reduce the contamination exposure possibilities. By the same time, we have to acknowledge that people need to have their meal. So we pack their meal, we put their meal in advance, we're tagging their seats so that they can be properly distancing among each other. And then our Ministry of Health officers have their station at the back of the aircraft so that they can monitor those who are showing symptoms, so that they can take them at the back side of the aircraft and isolate them from the rest. And the rest of the crew members are in the front. So, how many meals? Because of this exposure risk, we have to reduce only 2 packs of meal provided to them. And then when they arrive, we have proper decontamination process, check their luggage and belongings, send them through specially escorted bus directly from KLIA to HUKM Sepang, and keep them there within 14 days. This is the process. Okay, I already talked about nutrition requirement, complying the United Nations requirement for humanitarian assistance, and the agencies in charge in our temporary shelter is Welfare Department. And then I would like to touch a little bit about global outreach and how the criteria or consideration that we have to take into consideration, element that we have to take into consideration prior to providing any assistance abroad. The era where government knows and do everything has long gone. The government, federal and states has to work together with all other disaster players, especially the NGO. And sometimes they know better than us, and because the government cannot operate freely as the NGOs. We have to comply with the other host government requirement, whereby let's say they do not allow Malaysian government to send the assistance through the military aircraft. They require commercial aircraft. They do not allow any military personnel to handling the humanitarian assistance, because most of the time the military assistance will be the last options. Number 2, we have to also take into consideration the cost. Like in Sulawesi case, we know that there are demand by our own people to help people in Sulawesi by providing food, shelters, water. But then again, the cost to fly our items to Sulawesi directly, at least around one way is about 200 ringgit to get 200,000 ringgit to cater for the oil, the petrol for the flight to and fro, 200,000. If we send 3 times food relief to Sulawesi, it will cost us about 1.2 million just to cater for the sending food to Sulawesi. Alternatively, we can issue check to the Red Crescent in Sulawesi amounting to 1 million. But the challenge is our sponsor or NGO will not be happy, because they want to be able to chip in the sessions or in the food relief and humanitarian assistance for global outreach matters. So this is among simple consideration. not to talk about the process, the manifest checking by the immigration and customs, as well as the headache trying to let's say in Sulawesi, the airport is actually damaged, so we have to land at other area. So from point A until Sulawesi, we have to anticipate there are security issues whereby desperate people will rob us. So we have to be prepared all about this. How do we go about this? It's not easy. How do we go about this? So the challenge here is actually we have to discuss with the people. Like we know that Mercy and Zuchi is two NGOs that are really capable in terms of international relief. They have their partnering NGOs in the affected countries. So Mercy offering capacities of medical doctors, field hospital, whereby Zuchi volunteering their volunteers and some sort of financial assistance. And then again, we have to know the capacities of NGOs, and we have to know the requirements of the host government. Sometimes they do not want our people, they do not want our money, they do not want our food, because they have their own internal mechanism that dealing with this. They require from us field hospital, flight, and also water treatment facilities. So we have to know the principles and spirits of sending relief and aids to the needy countries is respecting what the victims want rather than to give what we simply don't want or what we want. So we have to ensure that this interest match, then it can only be synergized and be meaningful assistance to those countries in need. I already talked a little bit about the dietitian requirement, the expectations of the host government, and some sort of process when we want to deliver our international food relief and disaster assistance. And the last point I would like to touch about, don't worry, all this handout already being taken care of because I already circulated earlier to Professor Zahara. I would like to recap before I conclude. So remember the tiers of the disaster management: district, state, federal level, the secretariat, the chairman, and the type of assistance, and they have to work together, because no agencies can proclaim they are the sole heroes of disaster. Number two, I talk about standards and some sort of requirements that for to facilitate, especially at the temporary shelter for our flood victims, following the United Nations guidelines, humanitarian and refugee assistance. I already have some handout there. They even prescribe how much vitamins they required per victims per camp, so you can have further readings by reviewing my handouts. And number three, I touch about the complexities and process of delivering Malaysian assistance abroad. It's not as simply as what we want to send, we just send using commercial flight, cost consideration. We have to discuss with the recipient countries their do's and don'ts, their procedures, and their logistics arrangement, because most of the time the affected areas are in a havoc situation, and it will affect the securities of our personnel that are going there to assist them. So we have to respect their process. We have to follow their requirement, because at the end of the day, this is government to government assistance. If you want to go alone, you can just freely go alone, because you yourself responsible on your own life. But the government cannot simply send our people without assessing the situation first and ensuring that the assistance would be reaching the targeted area. So it's already about 25 minutes. I already touched most of the fundamental structures that I want to touch. So hopefully this will help you to have some basic understandings related to disaster management in Malaysia and how Malaysia dealing with other countries in providing food relief and disaster and global outreach. Thank you again, Professor Zahra. All the best to all the students. Till we meet again, if we can have proper class for better interaction between us. Thank you again. Assalamualaikum.